Hi, and welcome back to Psychology with me, Mr. Snyder, and today we're going to get into some new types of disorders, dissociative, somatoform disorders, and schizophrenia. Your learning targets are to summarize how theorists believe that dissociative and somatoform disorders occur, or the origins of such. We'll talk about the basic symptoms of schizophrenia, and we'll compare and contrast the two views of why schizophrenia happens. So dissociation is the separation of conscious thought from different mental processes. So it's basically separating your mind from your body. In some situations, it's very normal. If you've ever become so engrossed in a book, I know, perish the thought, but if you've ever become so engrossed in a book that you forget where you're at or you forget what time it is, that's dissociation. So it does happen normally, but if it occurs as a way to avoid a certain feeling or stressful event, it can signal a disorder. And here are those disorders: dissociative amnesia, dissociative fugue, dissociative identity disorder, and depersonalization disorder. The different views on dissociative disorders, psychoanalytic theory, although old and out of date, it suggests that people dissociate in order to repress unacceptable urges. Learning theorists believe that individuals have learned to kind of go to a happy place and not think about disturbing events in order to avoid these feelings of shame, guilt, or even pain, because a lot of these dissociative disorders happen after stressful events or even abuse. And cognitive and biological theorists really don't have an explanation of dissociative disorders. Somatization, as far as somatoform disorders go, are the expression of psychological stress through physical symptoms. These people are not faking it. They have psychological problems and they experience physical symptoms from those psychological problems, like paralysis. They honestly feel the pain. They are not faking it. And here are those disorders: conversion disorder and hypochondriasis. How do we explain somatoform disorders? Well, it's primarily psychological because there's nothing physically wrong with the person. So psychoanalytic theory says that when individuals repress emotions associated with forbidden urges, and instead those emotions come out symbolically as physical symptoms. So it's kind of a compromise between the body expressing the feelings and the fear of actually expressing them. It's kind of a halfway point between the two. Other psychologists say that people with conversion disorder actually convert the psychological stress and the anxiety into actual medical problems. Behavioral therapists say that somatoform symptoms serve as a reinforcer if they successfully allow the person to escape from anxiety. So if having a part of your body not work gets you out of a stressful situation, then your body will learn to do it over and over again. And there's also some evidence that biological factors and genetic factors may play a role in the passing down of somatoform disorders. Now let's talk about schizophrenia. Schizophrenia, although one of the main characteristics is hearing voices or seeing hallucinations, it is characterized by a loss of contact with reality. When a person can't tell what is real and what is not real, that is a symptom of schizophrenia. The symptoms are hallucinations, mostly auditory, but there may be some visual ones as well, even fully visualized persons, but mostly they're just shadows or morphing of certain things in their vision. Delusions believing something that isn't actually true, delusions of grandeur or believing you're more important than you really are, and the persecution of others. Also thought disorganization, so these people cannot organize their mental processes, and that's especially true with disorganized schizophrenia. These people don't have normal emotional responses, they don't know how to interact socially with others, and they tend to withdraw because of that. And also there's catatonia or catatonic stupor, which is an immobile, expressionless coma-like state. And then the three types are paranoid, disorganized, and catatonic. The explanations of schizophrenia in the psychological view says that it's the overwhelming of the ego by urges from the id, because the voices that people hear are usually very aggressive or even evil, and psychoanalysts would say that it's the id trying to get out. Fantasies become confused with reality. A person can't delineate between the two. And the environment in which a person is raised may help spur the disease if a person has a predisposition to have schizophrenia anyway, but it does not cause it. The biological view, studies try to link these abnormal brain functioning and structure with specific symptoms. Other biological characteristics or correlations that they've made are heredity, complications during pregnancy and or birth, and birth during the winter months for some reason are all shown to affect rates of schizophrenia. But the most likely is it's a multifactorial model, which means that biological and psychological factors interact in development. Even severely dysfunctional environmental factors are not enough to lead to the disease. And then here is a summary of all the views of the perspectives of schizophrenia. And that is all I have for you today, so hopefully that wasn't too painful for you. Fill out those learning targets, and I will see you back in class for more fun with mental disorders. Have a great night. Goodbye.